Hi, I'm Dr. Jason Itri, and today I'm going to talk about incidental findings and why it's important for radiologists to have a systematic method when they're reviewing imaging studies. An incidental finding is basically an important finding on an imaging study that your provider was not looking for or expecting. A great example of an incidental finding is an early cancer. An example would be if someone went in to get a chest CT for shortness of breath and the radiologist picked up an incidental renal cell carcinoma. And the great thing about picking up these incidental findings early is that you can find cancer when it can still be treated for cure. In this case, we have a gentleman who's got left flank pain and hematuria. He gets a non contrast CT of the abdomen and pelvis because that's the routine imaging study to look for stones. Right here, if you follow my cursor, you're going to see the kidneys. This is the left kidney, this is the right kidney. And these bright white dots are renal stones. So this gentleman has multiple renal stones. He has a large one in the left lower pole kidney, but those don't usually cause symptoms. Usually you have to have a stone in the ureter to cause symptoms. So we're going to follow the ureter, which is how urine goes from the kidney into the bladder. We're going to follow this ureter right here. It's this little little gray circle, and you've got fat surrounding it. So we're going to follow it all the way down. It's looking like a normal decompressed ureter. It can be hard to see sometimes because it's decompressed up against the psoas muscle, but we're catching it here again, surrounded by fat. And as we keep going down, we have a stone in the distal left ureter. So that's what's causing his symptoms. Now, this is where it's important for a radiologist to have a systematic approach because we need to be looking at all the important structures on the imaging study everywhere on the image. So as I continue my normal review, I will review and follow the colon. So here is the rectum right here, and this is a normal rectal wall. The dark black is gas in the rectum. The black around it is fat, and here's your nice thin wall. So we're going to follow it all the way around. Here's the sigmoid colon, and you've got a bunch of diverticuli, which is what happens when you don't get enough fiber in your diet. This is the descending colon coming up to the splenic flexure, which is right here next to the spleen. And then we follow the transverse colon across. It comes up here in the right upper quadrant adjacent to the liver called the hepatic flexure. And then now as we go down into the ascending colon, we're going to see an important change. This is a normal colon wall. It's nice and thin gray. You see black in the middle for gas. You see black on the outside for fat. But as we come down, we can start to see asymmetric wall thickening. Right now, you've got this thick gray, and that's a thickened wall. And as you keep going down, now you have circumferential wall thickening. And then as we keep going down to the cecum, now you've got normal colon wall here. There's a couple of different reasons why you could have rectal or colonic wall thickening. It can be peristalsis, it can be infection, or it could be cancer. What we're also seeing here is not just that there's a thickened wall, but you see how there's a nice, sharp, clean border between the wall of the colon and the fat. But if you look here, it looks smudgy. And that's because there's some sort of infiltrative process. This is actually a colon cancer that's extending through the serosa into the surrounding fat. We can go to a different plane, the coronal plane, and have a more anatomically correct view of the colon. So here's the hepatic flexure up here in the right upper quadrant. Here you have normal colonic wall. And right here, you see that puckering of that colon cancer. And you see the colon cancer in its entire length. It's about 4 to 5 centimeters. And then normal colon wall here at the bottom. This is your classic incidental finding. And why it's really important to pick up this incidental finding at this point is because there are no findings of metastatic disease. There's no lymph node metastases, there's no liver metastases. So we're able to pick up this incidental colon cancer in this patient when it can still be resected and cured. And this is one of the main benefits of doing the second opinion reads is that you can have an experienced radiologist who's used to picking up these kind of findings, who's got a very systematic approach to reviewing the imaging studies, and this is what they pick up. Having done radiology for over 15 years and been involved in a number of malpractice cases, this is exactly the kind of finding that gets missed. And this patient will come back in a year or two and now be symptomatic from the cancer because now they have lung metastases and liver metastases and the cancer's grown into the abdominal wall. So this is the value of a second opinion read, is you can have a radiologist look through and pick up these very subtle incidental findings that end up being early cancer at a point where they can still be cured. I'm Jason Itri. Thank you for your time.